So, good morning, everyone, and thank you for joining us today. My name is Heidi Fish. I'm Director for AKG Health, and along with my team, I'll be taking you through today's webinar on health and wellbeing at the workplace, and also giving some practical support for you employers. Over the next 45 to 60 minutes, we'll explore some of the common health challenges impacting today's workforce, discuss the role employers can play in supporting wellbeing, and share practical, cost-effective approaches that can help improve employee health, engagement and retention. So before we get started, just a few quick housekeeping points. The session today is being delivered as an education and informational webinar. Please feel free to use the Q&A function that you can see at the top of the screen there. We're not going to be using the chat function today. We are going to be using the Q&A function. So please feel free to use that for any comments or, oh no, my laptop's just about to restart itself, which is unfortunate. We'll leave some time at the end for questions and discussion. And just remember that there aren't any silly questions. We want this to be a really open and transparent forum, and we want you to get something out of it as well. And chances are, if you're thinking it, then somebody else is thinking it as well. So please do ask those questions. We'll be sharing contact details after the session. So should you wish to continue a conversation or find out more support that AKG Health can offer, then those details will be there for you. Today's session is designed to be practical. We won't be focusing on theory or legislation. Instead, we want to look at real-world actions employers can take to create healthier workplaces and better support their people. Next slide, please. So before we begin today, I wanted to give you a quick overview of today's session and introduce the colleagues who will be contributing. We've brought together a number of specialists from across AKG UK and DWP to share practical insights, examples and support options that employers can implement within their organisations. We'll start with a brief introduction from me, so here I am, and set the scene around health and wellbeing in the workplace. And then we're going to move over to Georgia and Ola, two of our health coaches, who will provide an overview of health coaching and workplace support, sharing how early intervention and personalised support can help employees overcome health-related barriers. Kirsty and Verity will explore health within the workplace, looking at common challenges employers facing, practical ways to support employee and wellbeing. And then we've got our lovely Ben from DWP, who's going to be giving us an overview of access to work, including the support and funding available to help employees remain and thrive at work. And then Kirsty and Verity will return to discuss prevention and external support, focusing on how organisations can take a proactive approach rather than waiting until it escalates. And then Joe from AKG will then talk about social value and inclusion, highlighting the wider benefits of creating supportive, inclusive workplaces for employees and communities. I'll then return, so you get the luxury of me again, to give an overview of our AKG Workplace Health Programme and some of the support packages available. And then finally, we'll wrap up with some key takeaways and next steps and hopefully some questions. So throughout the session, please feel free to ask questions, as I said, in the Q&A box, and we'll do our best to answer these as we go along, but we'll also leave time at the end, as mentioned, for those questions. So next slide, please. So before we move into today's content, I'd just like to spend a minute introducing AKG Health and the wider AKG group. So AKG Health is a part of the AKG group alongside AKG Employment, AKG Learning and Intuitive Thinking Skills. Together, we support individuals across their employment, learning, health and wellbeing journeys. AKG Health was created to bring together our specialist health and wellbeing services under one dedicated offer, helping individuals, employers and communities access practical support that delivers real outcomes. Our service spans 4 key areas, as you can see on the screen. There's the work readiness, workplace health, counselling and learner support. Whether we're helping someone overcome barriers to employment, supporting an employee to remain in work, providing counselling, or helping a learner stay engaged in our education, our focus is always on building confidence, improving wellbeing and creating sustainable outcomes. To date, we've supported more than 6,000 people and delivered over 35 health and wellbeing interventions, working with individuals, employers, training providers and public sector partners across the UK. at the heart of everything we do is a simple belief that when people are supported to manage their health and well-being, they're more likely to thrive in work, learning, and life. So now let's take a closer look at how health coaching and workplace support can help employers support their workforce. I'm going to hand back to our health coaches.
Thank you, Heidi. So yes, my name's Kirsty. I'm the health team facilitator here at AKG Health. And we also have Verity, who's going to be leading this section with me, who's also one of our health coaches at AKG Health. And we're going to be having a chat with Georgia and Ola just to get a better sense of health coaching and the benefits that it can bring. Okay. So Georgia, Ola, so for anyone that's listening who's new to health coaching, how would you describe it in simple terms?
Hi everyone, I'm Georgia, one of the health coaches, and I would say health coaching is really about supporting people to understand their own health as well as their well-being, and really helping them make changes that feel manageable to them. So I don't know about you, Ola, but a lot of the people that I work with are managing physical health conditions, kind of mental health challenges, or really low confidence around work. And it's about building that awareness, that confidence, and that practical, helpful strategies that help people move forward, but in a way that feels manageable and at their own pace.
Yeah.
Thank you for that, Georgia.
You're more than welcome.
So just a question for Ola. How would you say health coaching is different from things like counselling or occupational health?
Thank you. Good morning, everyone. My name is Ola, and I am one of the health coaches here at AKG. And yes, health coaching I think it's inherently different from counselling and occupational health, particularly in the way that it's delivered. So, for example, with occupational health, people would be referred because they need perhaps reasonable adjustments at work or adaptations at home to help them sustain their independence. And counselling as well, they would have been referred to explore things like trauma, coping strategies and things like that. So there's generally specific needs, and it really takes them back to bring them forward. With health coaching, it is very much more supporting this person to improve their health literacy, to improve their capacity to advocate for themselves, so that by the end of the health coaching sessions, they're able to maximize whatever service they come in contact with. So often we would meet people who don't know how to speak up for themselves when they see the doctors, or how to ask for what they need. And health coaching is there to kind of get them to that point where they know the right questions to ask. They know how to navigate the healthcare system. They know how to talk about their own health condition. They're able to advocate for themselves. And that means that they're maximizing, whatever services they're getting into, and they're also taking part in their own healthcare as well. So I think that that's the difference between health coaching and other services, really.
Yeah, it's definitely more forward focused, isn't it? It's like, what can we do differently from here and help those people move forward?
Absolutely, yeah.
That's great, thank you. So now we've got a better understanding of what health coaching is. If we think about why it matters in the workplace, from your experiences as health coaches, what do you think the biggest challenges are that employees face with their health and well-being, and what impact does that actually have?
I think one of the biggest challenges that we see is that people often feel very misunderstood or worried about how they're going to be perceived by their employer. So a lot of people don't always disclose their health needs, and that can then lead, as you can imagine, to people struggling in silence, which then impacts their performance at work. They feel really stressed, and this can result in sickness or absence, or even people not feeling as though they can stay in their role, so they end up leaving altogether. So I think when people don't feel safe or supported, it becomes much harder for them to stay in work or sustain work well. Ola, I don't know if you have anything to add there.
Yeah, I think I absolutely I agree with you there, Georgia. So we see a lot of issues around retention, but before we even get to the point where they're leaving, if the workplace is not such that they can open up. It's not an open culture where they can disclose and where they feel supported. We tend to see a lot of presenteeism as well, where people are in work, but they're not being productive and they're not particularly, like you said, disclosing why they're struggling, which then means that, they're struggling, the workplace is struggling, and everyone is kind of losing. And we see a lot of that. And you eventually get people having to then take that time off work much longer than they need when they've got to the point where they just cannot continue. So you see a lot of long-term sick leaves, a lot of doctors' notes where if it had been disclosed and dealt with in the first instance, it probably would not have got to that point, or there would have been something put in place for that.
It's often been building, like you said, for a long while before anyone really picks it up or knows about it.
Yeah.
That's great. Thank you.
So I know you picked up on about the well-being and retention. So if we look at maybe real life examples, then what would you say tends to change for people once they start engaging with coaching?
I think, like I sort of said earlier, people tend to feel more confident talking about their health condition, and they learn to navigate the healthcare system. They're just a lot more engaged because their perceived sort of self-efficacy, ability to go through this would have increased a lot. And I'll give an example of a lady that I worked with pretty recently, where she didn't even know she could ask for a second opinion from a different consultant or a GP, for example. And when she realized that, she was able to go back, ask for what she needed, explain why she was asking for a second opinion. And now she's got the help that she needs, and she's well closer to work than when we first started. Just from
Amazing.
just from that confidence in knowing that, what, I can ask for the things I actually need, and I can talk about my health condition more, I can explain myself more. And which means she's a lot more engaged, she's navigating the healthcare system, she's asking the right questions, and she's closer than she was before.
Amazing. I think, like you said there, Ola, having that ability to communicate your needs and have someone like a health coach to support you through that, so you're doing the right thing, is powerful, isn't it? Because you can take charge of managing what you need to help kind of yourself, but also everyone you come into contact with in your life as well.
Yeah, and also it also means that they're able to ask for things like reasonable adjustments. So if for example, if my break was spread across instead of just a chunk, how would that support me? Just asking for this reasonable adjustments, which are often not big things, the very small things that the workplace can work around. But it is just knowing when to ask and how to ask for that, isn't it?
Yeah, definitely.
Thank you. Yeah, so thinking about like early intervention and prevention, we hear those terms a lot, don't we, in this setting? So can you tell us a little bit about what that actually means in a workplace context?
Yeah, that is something that I'm actually really passionate about, just because I've been a beneficiary of that just in the last year. So I will just use myself as an example. So I had a point in the last year where I wasn't being as productive as I would normally have been. So my performance was quite low, and I was struggling, obviously. And I didn't really say anything in the first instance, but my manager picked this up, and she invited, a conversation. Ola, are you okay? And that led to a conversation once I understood that, she was actually wanting to support, not necessarily penalize the drop in the performance. And, it was just that communication. She was very proactive in picking up that drop and finding out if there's anything that the workplace could have done to support me. And I think that that's what early intervention is. It is about knowing your employees to the point where when you notice a drop in their performance or in their productivity, you're able to invite that question. You're proactive about inviting that opportunity to have a conversation around what's going on and what kind of support they need, and the kind of language that's used as well. So when my manager, spoke to me, I didn't feel like I was getting punished or I was I was getting penalized. It was supportive language. The kind of language that's used would obviously make them more likely to not be on the defense, but open up to you. And also actually doing something about the information that you receive and keeping them in that loop. I think that that's what early intervention and prevention is. And I'm grateful to have been a partaker of that.
That sounds like a important kind of example there, Ola, that you experience. And like you said, it's about kind of catching it before it becomes a more difficult problem for you both to kind of solve together. Yeah, that's great.
That's good.
No, that's really useful. Thank you. It makes a lot of sense, actually. Verity, do you have any final questions?
Yeah, so just one for yourself, Georgia. How would you say this kind of support may help people who might otherwise struggle to stay in work?
Yeah, I think like Ola's great example there, early support makes a huge difference. I think when someone feels listened to and supported from the start, they're much likely to reach a point where they feel they have to leave work. And it also gives organizations and employers that reassurance that if someone genuinely needs that time off, it is needed, it's appropriate and it's necessary, rather than situations escalating and becoming more complex over time. So overall, it helps create a more open, supportive environment where people can remain in work and in a sustainable way. So sometimes instead of kind of needing that time off, it's that ability to feel heard, listened to, and make kind of those adjustments as that happens.
Yeah.
Thank you.
Yes, thank you for that. It was really useful. And yeah, just giving people obviously an insight into the world of health coaching, so we know it's not just this concept that we don't understand, but we can actually see the benefits it brings for in a workplace setting. So that's really good, and we hope it's been particularly useful for those that that weren't aware of health coaching in the first place. So yes, next slide, please, Jack. So I'm going to hand over to Verity, who's going to give us an introduction now into health and wellbeing within the workplace. Over to you, Verity.
Brilliant, thank you. Thank you. So yeah, I'm just going to go into health and wellbeing within the workplace just in a little bit more detail. So we know that employee health, and wellbeing, it isn't just a personal issue. It has a direct impact on that organisational success. You know, we can see here on the slide that when staff experience poor physical or mental health, they're more likely to require time off work, leading to increased sickness and absence. And if health concerns aren't supported, employees may leave their roles altogether, which is not what we want. You know, that contributes to the higher staff turnover, increased recruitment costs. Even when employees remain at work, poor health can affect concentration, motivation, overall performance, and just the things that the ladies had previously mentioned. Those things are real life examples because it can happen in work as well. So even experienced employees, when they leave due to health related issues, the organisations lose those valuable skills, knowledge and expertise that takes time to rebuild and takes resources to replace even. So it's understanding that the direct impact that health really does have, and the importance that when it is controlled and it is looked after in the way for employees, that it can contribute to better success in the future, really. Next slide, please. Thank you. So, you know, as an employer has legal and moral responsibility to provide a safe working environment where employees can perform their roles without any risks or physical or mental health needs getting in the way. So we can see there that we've got safe working environment, reasonable adjustments where needed, and fair and supportive management. So if we touch on the reasonable adjustments, you know, that includes the flexible working arrangements, modified duties, any additional equipment, or phased returns to work, particularly for employees with disabilities or any long-term conditions. And when we look at the fair and supportive management, it's creating that supportive culture where employees do feel that they can come to you, not that they are penalised or they're scared to mention something because they don't want to lose their job. It's about addressing the workplace stressors where possible and encourage, you know, those who work for you or working alongside you to seek help as well, and seek help earlier, because we know prevention is always much better than a cure. So yeah, it's important to really understand that. Also, as employers, you're not responsible for, you know, diagnosing conditions or even acting in a clinical way, I think that can also be a barrier to even conversations being had, is that what do I talk about? Where do I touch on? I'm not qualified for this. So that's why it's just important to know what you are responsible for, what you're not responsible for, and where to signpost, which we'll talk a little bit about that later. So I'm just going to hand back over to yourself, Kirsty. Thank you.
Thanks, Verity. Yeah, so when we're thinking about how to respond in this context, with these conversations around health, there's no hard and fast rule. But a structure like this can help to guide supportive and professional conversations. It can provide structure that we feel we need, because navigating health conversations aren't always easy. So just something simple like this can help the employee to feel listened to and respected, while giving you as an employer and a manager some of that structure. Any information about health, as we already know, should be treated sensitively, and any information shared about those health conditions or disabilities should only be on a need-to-know basis, with the intention of providing that workplace support. Okay. And agree with your employee what needs to be documented, and always gain consent for that information sharing. Again, it's really important to document things, not to make the process overly formal, but just so that you've both got a record on what was said, what was agreed, and essentially something that you can look back on when you need to. Simple models like this can reduce repeated conversations as well, and it does help to create consistency. So when you may have multiple employees that bring forward health conditions, different symptoms and disabilities, but if you've got a structure in place, everyone knows they're going to be having similar conversations and similar structured, with whilst we do still keep things person-centered. It's not about putting this structure in place to treat everybody the same. This is the structure that we use just to gather that foundation, really. And again, there's no need for overly complex or formal processes. It's about just remaining supportive, practical and proportionate, and most importantly, human. So yeah, that's the take-home message, to just remain supportive and sensitive to anything that's disclosed. Okay. Next slide, please, Jack. So when we're thinking about the challenges that might arise, we know that workplaces aren't without those challenges, and that's okay. Managers, like Verity said, managers aren't expected to be oracles, with all of the answers. They're not expected to problem solve every single thing, but it's about having respectful conversations, responding in fair and respectful ways. Okay. Some requests may feel unreasonable and not practical, and again, that's okay, but it's about documenting the reasons why you feel it's not practical or appropriate. Explaining yourself, keep talking, don't shut down when those requests are made, but instead look at what can be achieved. What smaller and perhaps more practical adjustments can you put into that workplace, and to provide that support. So again, it doesn't take big changes, it doesn't take costly changes, it's those smaller changes that can make the biggest impact. And regular check-ins as well help to create that trust and allow any adjustments and support to be reviewed on an ongoing basis. That's really important to remember. And because someone's not legally required to disclose health and disability, it's about, when you're approached with those conversations, allow them to take the lead, because some people are going to be more comfortable with disclosing more detailed information than others. Okay, so it's about putting it in their lap, allowing them that safe space to bring the information forward they feel comfortable with. And focus on workplace support. Try not to focus on diagnosing a condition based on symptoms you've been presented with by your employee, but how can you provide workplace support, practical support to help them in their role. And yeah, you haven't got to become therapists, but it's about creating a safe culture where people can speak up early. So yeah, you're not there as managers to provide counselling, to provide therapy, and again, not all the answers, but it's about an everyday culture where people feel that health conversations are normalised. Okay. So moving on to the next slide, please, Jack. Okay. Here, we're just going to have a bit of an interactive activity. Please use the question and answer section. Reflecting on what we've covered so far and the information that we've received, as an employer, how do you think you can improve your communication when someone is disclosing a health condition? Are there any key words that spring to mind, or is there anything that you might already be doing within the workplace? So yeah, please feel free to type your answers in the question and answer bar, that function. Thank you. We do have someone that will be monitoring it as well, so they won't just go into the ether. We will be there, we will have eyes on them.
I think I'll monitor this, Kirsty, if we
Yeah,
want to kind of
definitely.
just move on, and then I can just keep, monitoring where we go from
Yeah,
this, if that's all right.
that makes sense. Yeah, thank you, Heidi. Okay, next slide then, please. Thank you. We're going to introduce our guest speaker, Ben Stykuc, who's from the Department of Work and Pensions, and Ben is going to be discussing access to work. Over to you, Ben.
Thank you, and good morning to everybody. If we go to the next slide, please. So basically, extending what my colleagues have already been mentioning on there, reasonable adjustments can be quite disconcerting because of the use of language. What are reasonable adjustments that can be made? Now, all employers must make reasonable adjustments when they know or could reasonably be expected to know someone has a disability, or a disabled member of staff or job applicant asks for adjustments. It may also be when somebody who has a disability is having difficulty with any particular part of their role, or, as we see quite frequently, someone's sickness absence may be getting worse, or their absence record may be deteriorating because it could be linked to their disability. Now, reasonable adjustments, as my colleagues have previously mentioned, may not necessarily cost a lot of money. It can be practical. We've talked about changes to working patterns, changing to working hours. Some person may be better in the day, later in the day, or earlier in the mornings. It might be, or they might have care situations. Can be easily done. I myself am bad of hearing, so I have noise cancelling headphones. Work perfectly for me when I'm on a webinar like this. But it could be something as simple as maybe moving a desk to a different part of the premises. It might be the lighting that might need to be adjusted. Just how we communicate a task to be done can be adjustments that can be acted on fairly straightforwardly without too much cost. Next slide, please. However, there might be times when some adjustments may incur significant funding issues. So how then can we potentially tap into support? And this is where Access to Work may come in. Access to Work is a grant that can fund support for individuals who have a disability, health or mental health condition. The aim is to really, as I like to call it, level up, to put people on the same playing field as everyone else. And ideally help people to stay in employment is the end goal. And it can be whether someone is self-employed, starting a business, or is under PAYE. On here is, and I imagine these slides will be shared, is the link on gov.uk, can easily be tapped into and looked at. But I'm going to explain it more on the next slide. So next slide, please. So Access to Work, as I mentioned before, is a scheme which covers the costs of workplace adjustments. Now, normally when I do these presentations, I try to make them interactive. Again, I'm conscious of time, but Access to Work, a maximum award is about £69,000 per annum. Now, that doesn't necessarily mean you can put an application in straight away. Oh, great, that's £69,000 per person, but it can cover quite a few potential barriers. So, for example, job coaching. An individual, because of their learning disability, may require a job coach, and that can potentially be either recruited from the own staff or buying another person in. Support with travel. This is a frequently used issue with people. Now, a lot of people, like myself, don't drive, so we rely on public transport. How do we get to the location if it's not accessible by public transport? Usually taxis. So Access to Work may part fund taxi costs. They would look at how much public transport we would regularly cost and then work out the difference. Adaptations to work environment. Again, I mentioned before about some basic adjustments with lighting, etc. But you may need to make adjustments to premises. It may be adjustments to desks. It might even need ramps put outside to make them more accessible to wheelchair users, for example. There's an awful lot of things that might be required. And finally, support with mental health. Increasingly recognised now, and there are several side strands to access to work, which talk about coping strategies and what potentially might be considered to be reasonable adjustments. These, again, don't incur a cost by using the access to work process. These can be tapped into and is a much shorter process to get the response back. I have to do a caveat with access to work. It can be a little bit of a waiting game for some of the applications because it depends what people are asking for. But the important part really when we're looking at access to work is understanding what individuals will need. What are they requesting? We mentioned earlier, is the adjustment being requested reasonable in the circumstances? So if we go to the next slide, please. Something that might be useful for employers to be aware of when having conversations with their staff. Now, in DWP, there is a health adjustment passport, which you can basically download off gov.uk. Also comes in easy read and a large print version. But you'll hear quite a few companies have health adjustment passports or carers passports, etc. And the idea is to help the individual to understand what it is that they require. So our health adjustment passport, for example, talks about what equipment is needed. Is there a speech issue? Is there a mobility issue? What is required to help that person do their job to the best of their capability? And also can be doubled up because if someone is having conversations with their management, it's useful just have it written down. People are not always the best at communicating and understanding what questions are being asked. So if it's written down, it just eases that anxiety for people. Also, if people need to make applications for access to work, it's really handy to have it written down what adaptations are needed, particularly, for example, if someone's looking at software. As we all know with software, joys of MS Teams, etc., there are lots of different adaptations that can be made to software to support people, but there's all these different packages out there, but they might not necessarily connect with the package that the company is using. So that kind of question can be looked at. What is it you need? What kind of software do you require? Because then when you're ringing up access to work, they haven't got to then go and try and find out what will work at the risk of a person being sent the wrong material. So a very useful thing to look at, easily accessible, and usually the individual employee keeps hold of the material. So therefore they own it themselves. They're owning that conversation. So we're talking again about that whole language situation. It helps that person feel like they're in control. And on the next slide for me, please. And the last bit I'm going to talk about is disability confident. Now, I'm hoping that a number of you on this call will either be signed up or be aware of it. If not, happy to have a conversation with you at some point, if necessary, afterwards. But Disability Confident is a scheme that is run by DWP for employers and service providers who can register and be assessed for. The idea is that people are signing up to say they're taking appropriate steps. And when you sign up, what you're fundamentally saying is that you're open to reasonable adjustments, you're open to guaranteed interviews if a person meets the minimum criteria for the role. So a person still has to be able to do the job that they are applying for. Also, that the vacancies are transparent, how people can apply for it. We are in an internet world now, but not everyone uses the internet. If I could get away with it, I wouldn't use it myself, but hey ho. But it is there. How do we then promote those vacancies to organisations? How will people know that your company is able to apply for them? There's currently about 20,000 employers signed up to Disability Confident. And we in the Bucks, Berks and Oxfordshire region run a forum every 6 months for employers to come along where we can kind of bring them all together. And we can talk about what much support is available, because there's nothing better than the peers having conversations with each other. How do we support people? You've had an issue with a reasonable adjustment. Maybe, I don't know, but someone else on the forum might be able to do so. So it's keeping that lines of communication open with everyone else, because some companies are bigger, some are smaller. Some will have more experience with dealing with people with disabilities, some not so. So it's making sure that in each situation, an organisation knows what to do and who to speak to. So that is just a whistle-stop tour of the support offer around via DWP. I'm now going to hand back to AKG for the next part.
Kirsty, do you mind if I just jump in with a question for Ben?
Yes, yeah, that's fine. Go for it. Yeah.
Ben, we've got a question. do we know how long the backlog is for access to work and what area of support is affected, please?
I don't have the current information on that, unfortunately, on there. I know it was quite a significant backlog, but they recruited additional people to get that down. I'm waiting for my meeting in the next week or so to give me the update. It's not overall. It depends on what the area of support is affected, please. I apologize. I'm not quite sure what you mean by that, but if it's because I think all the applications get dealt with on an individual basis. But I'm happy to take that conversation outside if you want me to.
Hope that helps, Michaela. And if we get any further information, obviously I can share with you when Ben feeds back. Back to you, Kirsty.
Okay, so I'll let Verity get on with this next slide. Thank you, Verity.
Brilliant, thank you. So we can see on here, that there is external support to be used, and it's important to not tackle it alone. As Ben mentioned earlier, there's access to work. It's available, there to be used. Of course, we know there's a backlog, but it's there to be used. So it's important to know that it is there. And it's important to know which support is available for your organisation as well. For bigger organisations, there may be employee assistance programs, which we can see there from the examples of support. They provide confidential support for employees, often including counselling, legal advice, financial guidance and wellbeing resources. And then there's occupational health services as well, which may be accessible for the bigger organisations, that will provide assessments and recommendations for workplace adjustments, phased returns to work, and strategies to just help employees remain in work safely as well. But if that's not accessible, then there is still support, and there's a lot of free support as well. Organisations, local charities and support services that we know of, NHS talking therapies, domestic abuse services if needed, substance misuse services if needed, and financial wellbeing organisations as well. And there is also mental health first aiders as well, that are trained members of staff who can recognise when someone may be struggling, provide initial supportive conversations and signpost them to appropriate professional help. So if that's something you may feel that may be beneficial and useful within your workplace, then you can actually train up your employees as mental health first aiders. That will help create that culture where conversations about mental health are normalised, increasing that awareness and reduces stigma. So there's a lot of free training available as well. But yeah, I'm just going to hand back over to Kirsty. Thank you.
Thanks, Verity. Yes, next slide, please. Thank you. Yeah, we always want a preventative approach rather than a reactive approach, don't we? Because we don't want to see people struggling. We don't want to wait until performance drops significantly. Like Ola brought in her real life experience. It can happen all the time, can't it? When people are struggling, things are building up. So we do need to have those conversations early. We don't want to see people struggling with the physical or the mental health, or a combination of both. So yeah, they should be addressed before escalation. And employees are always more likely to seek support when managers are approachable, and when those health and wellbeing conversations are normalised. It's about the normalisation. We don't want to create a culture where when someone brings something forward, it's seen as negative or extra work or something to deal with. We need to make sure that health is a priority within the workplace setting. Again, and just touching upon the things that Ben mentioned as well, it's about the small changes that can be made now. They don't always have to be costly. It's that sort of tagline, isn't it, that small changes today prevent bigger challenges tomorrow, essentially. And adjust early and review quickly. That's another key take home. Make those adjustments that are practical, that are proportionate, that are reasonable, and review them. So we've got this support, so we can adapt the support over time. And again, that will also help to prevent the escalation, and it'll give us a nice continual flow of support and those adjustments. So prevention isn't this policy on paper that, again, that has to be complex and overly formal. It's creating a culture that people experience day to day, a safe and supported day-to-day culture. Thank you. So I'm going to hand over to our next guest speaker, Jovan from AKG, who will be talking to us about social inclusion in the workplace. Over to you, Jo.
Thank you, Kirsty. Good morning, everyone. Thank you so much for having me. Lovely to be here. I just wanted to come and talk about social value, social inclusion, and how it all ties in with what we're trying to achieve today in health and wellbeing in the workplace. So next slide, please, Kirsty. Thank you. So social value commitments. So slight change of pace here in terms of what we're talking about. What are they and why do they matter? So a little definition on the screen there for you. Social value commitments are actions and pledges made by organisations to create positive social, economic and environmental outcomes alongside their core business activities. And they are there to improve the well-being of employees. As you can see, I've highlighted it, communities and society as a whole. So anyone who works in, or particularly works in a company that delivers government, central government or local government contracts, should be well aware of, or if you're not, go and have a chat with one of your departments, because you will most certainly have social value commitments that are within that contract, so that the government likes to know that you are putting value into your community. And actually it's becoming much more popular with organisations outside of those contracts, because generally keeping your community safe and well and investing in it is seen as a really good thing to do. So on this slide, I've just put a number of social value commitments that actually link with employee wellbeing, which are quite popular, and people think it's, the right thing to do, because when we talk about employees, they're still very much part of your local community. So anything you can do right from the initial process of inclusive recruitment, making sure that everybody has access to opportunities at your organisation, making sure that people know that they can develop their skills, that they can undertake some mentorship, continuous learning, and then also take place in things that inspire them within the community, and have a wonderful workplace. These are all really good things to have as an organisation operating in the community. So yeah, some popular social value commitments there. So next slide, please. So social value, supporting wellbeing at work. How does it actually work in practice? So on the previous slide, we looked at some wonderful commitments that people can make in an organisation to social value, but what does that actually look like, and why and how does it impact wellbeing at work? And actually some of the things that we've already talked about on this webinar are things that you can put into place, which will then increase your company's own social value anyway. So we've talked about employee wellbeing, and we've talked about employee assistance programs and mental health first aiders. Well, of course, they're naturally going to support and reduce stress and present people with better mental health within the workplace. So immediately you can start to see that impact. Other things such as community engagement. We have a volunteering program here at AKG, and I'm really proud to say that since I've been at AKG, I've used every volunteering day that's been open to me, whether that's with a group within an organisation or I've gone out as a solo volunteer. And you really do feel special when you go out and do something like that. And I have not come back from a day yet where I've gone, do you know what, that was brilliant, I've had the best day, I really feel like I've achieved something. They can really make you feel like you've got a great sense of belonging to be able to go out and represent your organisation and support your local community. And again, we've mentioned inclusive employment and fair work. If you've got those workplace adjustments in place, such as Ben's been talking about, and you can be able to demonstrate that you've got flexible working, well-being practices, you're naturally going to make people feel much more engaged. They feel valued. If people feel valued, they feel supported and they feel safe. And naturally, that's going to start translating into how they feel at work. So social value really is the bridge between what organisations commit to and then what employees can actually experience day to day. And those experiences about feeling better and about feeling well at work are going to make an impact on your workforce. Next slide, please. So the community engagement, I thought I'd just give a focus on, community engagement contribute to employee wellbeing, and just do a bit more of a deeper dive into this, because community initiatives aren't just a nice to have. They really can create belonging by bringing people together. They give them a shared purpose and help them feel part of something bigger than their role. And then belonging is also created when people connect through shared experiences and purpose, and not just policies. So you can see from people participating in volunteering, in community events, in charity initiatives, whether you've got a charity of the year, that automatically fosters that belonging connection. People get to connect with people in the organisation they might not usually do, fostering connections across different teams. They connect beyond their professional roles, and they start to meet other people who can contribute something to their own well-being. And again, you also then give yourself a purpose. You're part of something bigger. You can really see an impact on the communities that you're working with. My most recent volunteering day, I'll just share a little bit with you. I, with the rest of my team, went to an organisation in Shropshire that's a rehabilitation centre, mainly for women who are on probation. And I did get to walk an alpaca, which did make me feel absolutely wonderful, I'm going to say, so just to throw that in. But we also did some really significant jobs for them. We helped concrete a driveway so that they could create a bigger space for people who were visiting the centre to be able to come in. And that was a real sort of 10-man job between everything that we had to do. So you came away thinking, do you know what, we've really helped somebody do a job today that they might have to have gathered more volunteers in, or had more, tried to find something else to be able to get that work done. And we were able to see the difference that organisation makes to people's lives, and you just felt like you were then part of it, and you really were something bigger. And like you say, when you feel like you're part of something, you feel included. And when you feel included, you feel accepted and you feel appreciated. You've got greater engagement in your work, and that naturally then starts increased participation and the overall well-being. So these social value commitments are really important to building that culture within your organisation, where you've got a really strong culture of well-being. Next slide, please. And again, this is just really emphasising more of what I've already said. This is having a really good social value commitment, social value policy, social value strategy can really create that kind of workplace where people are connected, motivated, they feel like they belong, and they feel that they're supported. People stay with the organisation longer. They become positive about the organisation. I feel incredibly proud to work for AKG, because I feel that I work in the kind of environment that does all of these things. And when I go out, I wear my lanyard with pride. I've even been seen to wear it on the train. I am that person. And of course, all of these things do make us healthier, happier people. Next slide, please. And there we go. There's the summary. The heart in the hands. Social value initiatives promote social inclusion by creating fairer access to opportunities, supporting underrepresented groups, and reducing barriers that can prevent people from fully participating in work and society. And then by investing in diverse recruitment, skills development, community engagement, and employee support, employers can help create a workplace where everyone feels valued, included, and able to succeed. And let's face it, what more do you want from a workplace when you can do that? I think that's it from me. Thank you very much.
So you have the joy of my voice again. So if we could just go to the next slide, please, Jack. You've heard me mentioning throughout the webinar today that at AKG Health, we have a workplace health programme. And I thought it was appropriate that we kind of share that programme with you. So at AKG Health, we believe that good work and good health go hand in hand. And I think one of the things that's really, really come to fruition today, absolutely, is that well-being in the workplace is no longer a choice. It should be a must. So our workplace health programme has been designed to help organisations support employee wellbeing, and what that will do is improve retention, reduce sickness absence, and create healthier, more productive workplaces, which in turn will reduce attrition rates, which reduces cost essentially. It's unlike a traditional employee assistance programme. Our offer focuses on practical, preventative and proactive support through our coaching. We work alongside employers to help individuals manage health challenges before they become a barrier, as we've spoken about quite a lot today. We've talked about trying to really hone in on those early intervention to enable us to be able to support some of those employees. Our support includes one-to-one health coaching, return to work support, maternity, paternity and adoption returner programmes, neurodiversity workplace support, wellbeing webinars, manager guidance and specialist health interventions. We can provide support at an individual level, team level or across an entire organisation, tailoring our approach to the specific needs of the workforce. Ultimately, our aim is simple: to help employees to stay healthy, remain engaged in work and feel supported throughout their employment journey. I think it's really important that we're really focusing on this, and one of the things that I wanted to highlight today is as a small to medium enterprise employer, it can feel quite daunting in this space. It can feel like things are going to be costly, and actually you know, I think we've proven today that a lot of that is myth busting, and actually just by having those early conversations we can eradicate a lot of that cost. Next slide please. So we've heard from lots of our experts today, who I'm really grateful for joining the call today. But I think the simple thing is, let's not overcomplicate this. You know, just keep those conversations open, keep it fluid. If you recognise any differences in behaviour in any of your employees, just have a simple conversation. Don't forget that we're all just people at the end of the day, and we all deal with things differently, we all respond to things differently, and just one simple conversation can actually support an employee to feel so valued. Just go on to the next slide, please. So I wanted to kind of thank everyone really for coming today and all your interaction. Thank you for all of your comments on the questions that we've asked in the Q&A. Hopefully I've answered all those questions, you know, effectively, but everyone will have my email. We will send out slides from the webinar following this, but also Joe will be delivering a social value for SMEs and VCSEs, which is on the 16th of July. So I'm going to leave that QR code on there just for a minute, just in case anybody would like to register. But for those of you that do use LinkedIn and any social media, we will be sharing that kind of following this as well. If I can just move on to just the final slide then. So again, I just want to say a huge thank you. You can see my email on there. I'm always open to any conversations that are health related or otherwise. I'm really grateful for your attendance today and for your interaction, and we will send out the slides following this. Thank you very much for your time, and thank you to my guest speakers.